CHNA is the Community Health Needs Assessment, and as a nonprofit healthcare system, Bozeman Health does one every 3 years. We're still seeing that a high percentage of community members will say that their own mental health is fair or poor versus good, great, or excellent, and that's obviously not what we want to see in our communities.
Living in a place like Big Sky does come with some challenges. It's not all paradise. There's some isolation, particularly with the pandemic. It's more difficult to receive services.
I mean, resort communities are places people like to party and have fun. So one of the things we have to keep a close eye on is our substance use.
A lot of kids are dealing with school-related stress, family-related stress, job-related stress. Seeking help after that is a struggle because of the stigma.
Prior to Women in Action bringing in therapists, prior to the hospital having therapists and clinicians, people were having to drive to Bozeman to get the type of assistance and help that they needed.
There was really a lack of resources, and that's one of the reasons that behavioral health was such a significant need up in Big Sky.
We work closely with our operational leaders to more fully understand what's going on from a clinical side and how our community benefit strategy can complement that work that's already going on clinically.
Dr. Maidman was one of the associate medical directors with Western Montana Mental Health Center, and recognizing the need, Western Montana Mental Health Center let us contract for some of his time to serve Big Sky. And Kathy Damberger was teaching at the university, at Montana State University, and we reached out to her and she agreed to also provide services up there.
There's just a tremendous amount of work that we're part of, sort of destigmatizing issues around behavioral health and really creating the idea of a healthy body, healthy mind, and what does that really mean? And how do we really open up the door to talk about things that really bother people.
The more resources we have from all sorts of different avenues and perspectives to bring people to that state of contentment is so important.
We are an open clinic for people in Big Sky, so you don't have to be assigned to a primary care physician. If you need help, we want to be available to give you help. We do now have the 24/7 telepsychiatry, which is available. And we formed partnerships with some of the community providers so that they can deliver telehealth. We're also exploring some of the digital therapies that are available so that people can be able to do self-monitoring and self-regulation at home. And then we're also looking to partner with Madison Valley Medical Center to see if we can't bring some therapists to Big Sky for the patients who just need some additional support, counseling, and therapeutic interventions.
There's a lot of momentum right now towards mental health. The older generations are realizing that, hey, we have to help the younger generations. And so we're gonna make the efforts, we're gonna help them. Sort of a combined effort, a coalition of people sort of seeking to make and attempting and trying and striving to make a change.
I think we all have heard the term, it will take a village. It's going to take all of us working together.
We can really continue to live in this beautiful environment and see it as this beautiful environment when we have this support within our community and within each other to show up for one another and to continue to stay strong as a community.